not at DCH. And I've had some trouble with WebEx myself in the past, so hopefully we can get through this and it all works. So we will begin. If Denisha, would you do a roll call, please? Make sure we have a quorum.
Yes, Chairman. Norman Boyd.
Here.
Roger Folsom.
Here.
Russ Childers.
Here.
Kenneth Davis. Anthony Williamson.
Here.
Russell Crutchfield.
Present.
Mark Trail. And David Cruz.
Here.
Okay, that completes my roll call, Chairman.
Thank you, Denisha. We do have a quorum. I think Dr. Davis had emailed earlier and saying due to an emergency he wouldn't be able to join us, but appreciate all of you joining this morning. We will proceed here with our agenda. Today's agenda includes several items of which the board will be asked to vote on. One will be a final adoption, and 6 items on the agenda will be initial adoption votes. And following that, we will have a legislative update. So with that, we will start off with, I will ask our Secretary, Russell Crutchfield, if he has read the minutes of the April 8th meeting, our last board meeting, and if he would recommend those for approval.
Well, good morning, Mr. Chairman and the rest of the board. I've reviewed the April 8th meeting minutes and found them to be correct and in order. And Mr. Chairman, I move that we approve the April 8th board meeting minutes.
Mr. Crutchfield has recommended approval of those minutes. Is there a second to that motion?
Second, Mr. Chairman, Folsom.
Roger Folsom has seconded. All in favor say aye.
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 Opposed? Abstaining? Hearing none, the minutes are approved, and thank you very much. Next, on the agenda, I will turn it over to Commissioner Berry for his report. Hello? Hello? Am I muted?
No, Mr. Chairman, we can hear you, just can't hear the commissioner.
Second.
What about now? How about now?
Yes.
Great, thank you. Thank you, Mr. Chairman, and I echo your thoughts about not being in person, and I'm looking forward to all of us being in person sometime in the near future. But I appreciate everybody's flexibility and being willing to join in this venue. I have one quick update. I know we have a full agenda, but wanted to let the board know we are in the early stages of beginning to craft and put together the pieces that will help us craft an RFP for the development of the procurement that will go out for the new 2024 CMO procurement. We will be looking for innovation. We'll be looking at identifying providers and partners that will be looking to serve Georgia's most vulnerable youth in creative ways and are willing to be great partners with us. We've had a long history of doing some great work together, and I suspect that we'll see some great applications come in. Again, early stages, but we want to make sure that we're getting the most bang for our buck and that the return on investment, these are very high dollar RFPs and contracts, and we want to make certain that the quality is where we need it to be and that the people that are being covered are getting the services that they deserve. So just wanted to give the board an update on that. You may begin to hear about that and did not want you to be caught off guard. Again, we're still a ways out from doing that reprocurement. We have an agreement with DOAS and CMS that we will have contracts in place by 2024. So this is a long process. A lot of detail goes into it, but it's an exciting time. And I think the state will, working with other state partners, agencies, come up with a really comprehensive approach to what our expectations are of serving this population. So, Mr. Chairman, I know, again, we have a large agenda today. I certainly can answer any questions. Brandy will give a very comprehensive legislative overview, but that's what I have this morning. And again, thanks everybody and to the members of the board for joining us today.
Thank you, Commissioner. Are there any comments or questions for the Commissioner? Hearing none, we will move into that agenda, and I will turn it over to Kim Morris, our Director of Reimbursement. And Kim, you have the majority of the items here, and we'll ask that you go through each, and after each we will call for a vote. The first one is going to be a final adoption presentation related to direct payments to public hospitals. So Kim, you may proceed. Thank you.
Okay, good morning, Chairman Boyd. Commissioner, I want to make sure everyone is able to hear me.
Yes, we can hear you fine.
All right, thank you very much. Presenting today for final adoption, the Medicaid Care Management Organization's directed payment programs to public hospitals. This has an effective date of July 1, 2021. The department is proposing to implement a new directed payment program for the Medicaid Care Management Organizations and eligible participating hospitals. The total cost is $188,544,113. This includes federal funds as well as state funds that will be procured through IGT. An opportunity for public comments was held on April the 15th. There were no public comments. We did receive 6 written comments. They were from Christopher Dorman at Tiff Regional Health Center, Julie Havener at Colloquy Regional Medical Center, Carrie Summers, Georgia Hospital Association, Brian Church, PB Putney Health System, Jonathan Lewing of Emory Healthcare, and Matthew Hicks with Grady Health System. All of the respondents expressed support for the Medicaid Care Management Directed Payment Program. The DCH response is that we appreciate their support and thank the comments for their responses. We did receive additional responders that asked DCH to establish an interim payments program similar to the recently approved Physicians Directed Payments Program. DCH did agree to revise the preprint language to read as follows. The separate payment term will be paid twice a year with interim payments based upon March 1st, 2019 to February 2019, 2020 utilization and a final reconciliation at the end of the year using fiscal year 2022 utilization. Additional requests from the responders was that DCH consider the impact of the direct payment program will have on disproportionate share calculations. DCH's response, we did review the DISH calculations and agreed to revise the Hospital State Plan Amendment 13-002. DCH would add the following language to the state plan amendment. For hospitals receiving directed payment program rate adjustments, the allocation increased by the amount of the directed payment intergovernmental transfer. The purpose of the hospital directed payment program is to provide hospitals with additional Medicaid funds to continue to provide services to eligible Medicaid recipients. So are there any questions from the board?
Any questions, Comments?
Okay. Hearing no questions, I ask the board to approve for final adoption the Medicaid Care Management Organization's Directed Payment Program to public hospitals with an effective date of July 1, 2021.
Is there a motion to support approval for final adoption?
Trail, so move.
And Mark Trail has made the motion for approval. Is there a second to that, please?
Second.
David Cruz.
Yep, Russ Childers has seconded the motion. All in favor say aye.
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 Opposed? Abstaining? The motion carries. And thank you very much, Kim, for the work that you've done on this and for the responses that you've given to the public comments. Thank you for that. And you may proceed to your next item.
Okay, today I'm presenting a request to approve a 3% increase in the dental reimbursement rates for 15 select dental codes. This has an effective date of July 1, 2021. Pending Centers for Medicare and Medicaid Services approval, the department is requesting this increase in funds. For fiscal year 2022, the General Assembly appropriated $354,137. $116,647 are in state funds. Included in your briefing document is a listing of the 15 select dental codes. The chart includes a listing of the procedure codes, the current allowed rates, the new rates with the 3% increase, and the last column shows the rate increase. There will be an opportunity for public comments on May 18th, 2021 at 10 a.m. via WebEx, and written comments are due to the board by May 25th, 2021. Are there any questions from the board?
Any questions or comments from the board? Hearing none, is there a motion for approval for initial adoption?
Motion to approve. This is David Cruz.
Motion has been made to approve of Mr. Cruz. Is there a second?
Trail, second.
There's a second by Mr. Crutchfield. And is there the vote? All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved for initial adoption. Kim, thank you so much, and you may proceed.
Okay, so I'm also presenting for initial adoption, approval to increase the rates for 18 select primary care and OBGYN codes to the 2020 Medicare level. This change is effective for July 1, 2022. Pending Centers for Medicare and Medicaid Services, the department is proposing to increase the rates. For fiscal year 2022, the General Assembly appropriated $21,442,954. Of that amount, $7,097,618 in state funds. Also included in your briefing document is a listing of the 18 select primary care and OBGYN codes. The chart includes a listing of the codes, the current enhanced rates, the new 2020 Medicare rates, and the last column shows the rate increase. There's an opportunity for public comments on May 18, 2021 at 10:45 a.m. via WebEx, and written comments are due to the department by May 25th, 2021. Are there any questions from the board?
Any questions or comments from anyone, please?
Okay, hearing no question, I'm sorry.
Yeah, I said hearing none, is there a motion for approval for initial adoption, please?
Motion for approval, Mr. Chairman, Roger Folsom.
Okay, is there a second?
Trail, a second.
Second, Russ.
There is a second, I believe, from Mr. Trail, also from Mr. Childers. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Kim, you may move to your next item. Thank you.
Okay, presenting for initial adoption, approval to increase the Medicaid rates for nursing home mechanical ventilator care program with an effective date of July 1, 2021. This is also pending CMS approval. Just want to note that we did have a similar similar presentation, which did receive final adoption by the board last year, which took the rate to $556.77. That has been submitted to CMS. We have not received CMS approval yet. They are very backlogged in approving SPA's state plan amendments that have been submitted to them. But this new proposal would take the rate from the $556.77 to $589.62 per day. This increase in funding is through Appropriation House Bill 81. The total cost for the increase is $1,351,195, $447,921 in state funds. There will be an opportunity for public comments on May 20th, 2021 at 10 a.m. via WebEx, and written comments are due to the department by May 27th, 2021. Are there any questions from the board?
Any questions or comments from the board, please?
Okay, hearing no questions, I ask the board to approve for initial adoption the increase to the Medicaid nursing home mechanical ventilator care program rate with an effective date of July 1, 2021.
This is Russ Childers. I so move.
Okay, it has been moved by Mr. Childers to approve. Is there a second?
Crutchfield, second.
Mr. Crutchfield has seconded. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Kim, thank you very much, and you may move to your next item.
Okay, and this is my last presentation. This is also for initial adoption to increase the nursing home reimbursement rates to include updating the rates to the 2019 cost report, the general and professional liability, the property tax pass-through rate, a 5% growth allowance, inflation, and a whole harmless provision for the first year. And this has an effective date of July 1, 2021. The fiscal year 2022 House Appropriations Bill 81 includes funding for the department to update the nursing home reimbursement rate. The cost report year will be updated a minimum of every 2 years. And during the transition year, which is moving to the 2019 cost report, the department has been asked to apply a whole harmless provision to the nursing home reimbursement rate. In essence, no nursing home will be negatively impacted by this transition to the 2019 cost report rates. The total cost for the changes is $104,433,079. Of that amount, $32,948,636 is in state funds. There's an opportunity for public comments on May 20th, 2021 at 10:45 a.m. via WebEx, and all written comments are due to the department by May 27, 2021. Are there any questions from the board?
Any questions or comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Trail move.
Mr. Trail has made the motion for approval. Is there a second?
Second, Folsom.
Roger Folsom has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Kim, and thank you so much for all your presentations today and the work that you put into this. Thank you.
Thank you very much.
Next item on the agenda, Lynette Rhodes, Executive Director, Medical Assistance Plan, will present for initial adoption consideration elderly and disabled program or waiver program rate increase. So Lynette, you may proceed. Thank you.
Hi, good morning, and thank you, Chairman Boyd, Commissioner Berry, and members of the board. Pending initial adoption from the board and approval from the Centers for Medicare and Medicaid Services, we are proposing to increase the reimbursement rates for all services provided in the Elderly and Disabled Waiver Program. The increase will affect all services provided through the waiver program, which includes the Community Care Services Program, also known as CCSP, and the Service Options Using Resources for Community Environments Program, commonly referred to as the SOURCE program. This rate increase will be a 10% rate increase for all services across the board. The services impacted are listed in the public notice document. The chart includes the current rates, the proposed rates, and the fiscal impact to state and federal funds. The proposed rate increase will be effective July 1 of 2021. This rate increase is based upon the provisions of House Bill 81, which is the Appropriations Act for State Fiscal Year 22. The state fiscal year 22 expenditures for this rate increase are as follows. Total funds is $31,531,545. State funds represents $9,948,202, and the federal funds represent $21,583,342. An opportunity for public comment will be held on May the 18th at 11:30 a.m. via WebEx. I will now pause for any questions.
Any questions, comments from the board for Lynette, please? Hearing none, is there a motion for approval for initial adoption?
Crutchfield moves to pass.
Mr. Crutchfield has moved to approve initial adoption. Is there a second?
Trail will second.
Mr. Trail has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Lynette, and thank you very much for your presentation this morning, and we'll visit again after the public hearing and when you bring it back for final approval.
Thank you.
Next item on the agenda is rules and regulations for caregiver registry. Initial adoption. Nigel Lange, Deputy Inspector General, will make that presentation. Please proceed.
Good morning, Chairman Boyd, Commissioner Berry, members of the board. The Georgia Caregiver Registry rule is being presented today for initial adoption to comply with the provisions of Senate Bill 406 from the 2018 Georgia legislative session, which allows DCH to create and maintain a Georgia Caregiver Registry. The law actually became effective on October the 1st of 2019. The Georgia Caregiver Registry is known within DCH and outwardly facing by its operational title, the Georgia Caregiver Portal. The purpose of the portal is to allow private family employers who are relatives or guardians of elderly persons to obtain an employment eligibility determination from DCH for current and prospective employees. These employees will solely provide personal care services to the employer's family members or wards in Georgia. The portal will provide family employers with access to employment eligibility determinations in the same manner that employees who work in licensed facilities such as nursing homes, assisted living communities, and home health agencies do. The use of the portal is voluntary. The fee to use it per background check is currently $51.50. The caregiver portal will not be used by licensed facilities or other entities or any individuals to determine a person's employment status for any other purpose. Licensed facilities currently make use of the established system known as GCHECS, which is the Georgia Criminal History Check system. The DCH Background Investigations Unit is increasing the awareness of the caregiver portal through several methods, primarily training webinars. Have a web page currently stood up which has frequently asked questions and other literature and information regarding the portal. We also have plans to make use of communications office with the outreaches that they use, social media, the Facebook outreaches, and so forth. The public hearing for this rule is scheduled for June the 8th, 2021 at 10 a.m. via WebEx. Written comments are due by 5 p.m. on Friday, June the 11th, 2021, and final adoption is tentatively scheduled to be presented at the board meeting on the 29th of July, 2021. With that, I'll pause for questions.
Any questions or comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Carol, so
Approved, David Cruz.
Mr. Cruz has moved for final adoption or initial adoption approval. Is there a second to that?
Second, Russ.
Mr. Childers has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved, and thank you very much for that presentation.
Thank you.
That concludes the items for consideration and request for voting today. I'd like to move to the next item on the agenda, which is a legislative update, and Brandy Sylvan, Director of Government Relations, will present that for us. Please proceed.
Hi, good morning, everyone. Chairman Boyd, members of the board, Commissioner Barry, I appreciate the opportunity to present to you today an update on the 2021 legislative session. The General Assembly made several changes to their operations this year in order to accommodate the public health emergency. All committee meetings were streamed live online, and most permitted virtual testimony. While it was certainly unusual to spend the bulk of session outside of the Capitol, I certainly want to commend the legislature for identifying solutions that would allow continued public engagement while reducing the volume of people physically present in the building. Following the events of the past year, two issues that garnered significant attention during this session were election reform and law enforcement. So while healthcare was not as much of a focus this year as it has been in previous years, there was still a significant volume of bills that DCH was monitoring for potential impact to the department. During my presentation today, I will provide a high-level overview of bills that received final passage and will require action by the department. I don't intend to go into too much detail, but certainly if you have additional questions, I'll be more than happy to answer those. So the first bill I wanted to cover was House Bill 93. This was a department bill which removes the requirement that laboratories in Georgia obtain a state license. Of the approximately 10,000 laboratories licensed throughout the state, all but about 400 are already exempted from this licensure. Removing the requirement for state licensure will ensure that all facilities are subject to the same requirements, and it will ease staffing concerns for the non-exempted labs. The Healthcare Facility Regulation Division will continue to provide oversight of these facilities on behalf of CMS and ensure that certification per federal requirements is in place. As a result of this bill, HFRD will need to present rule revisions to the board. This bill is effective July 1st, 2021. Next is House Bill 146. This bill provides for state employees who have been employed for at least 6 months. It will provide 3 weeks of maternity or paternity leave once in a 12-month period. This leave will be available following the birth of a child, as well as placement of a minor for adoption or foster care with an eligible employee. This bill also goes into effect July 1st, 2021. Next is House Bill 163. This bill directs the Department of Community Health to submit a state plan amendment to CMS to implement express lane enrollment in Medicaid by July 1st, 2022. This bill will allow DHS to automatically enroll and renew eligible children in Medicaid based on application data received for a supplemental nutrition assistance program. DCH is working with DFACS to examine modifications that will be needed in Gateway to accommodate this legislation. House Bill 271 requires the department to assess provider matching payments on ambulance services for the purpose of obtaining federal financial participation for Medicaid. The intent of this legislation is to allow private ambulance services to obtain the ambulance UPL for which public providers are currently eligible. DCH will need to submit a state plan amendment to CMS to implement this change. This bill is also effective July 1st of this year. Next is House Bill 307. The intent of House Bill 307 was to permanently implement some telemedicine provisions that were permissible under the public health state of emergency, particularly related to the provision of mental and behavioral health services. This bill allows patients to obtain telehealth services from their home, workplace, or school. It also permits audio-only care under certain circumstances and prohibits the requirement of an in-person consultation before receiving telemedicine services. Privacy concerns are addressed by requiring that all services must comply with federal and state law. This bill was effective upon signature, and the governor signed the bill on May 4th. House Bill 553, as introduced, this bill allows the Office of State Administrative Hearings to conduct hearings electronically. It permits documents to be filed electronically and allows OSA to serve parties electronically. DCH requested the addition of language in a substitute version of the bill, which adds the department as a reviewing agency for administrative hearings. Previous law required that OSA be the final decision maker in such hearings, placing state law in conflict with federal law. Federal law requires that Medicaid appeal decisions must be able to be reviewed by the Medicaid agency. Including DCH in the definition of a reviewing agency in this code section will allow for OSA issuance of initial decisions in DCH-related matters, while permitting commissioner-level review where required by federal statute. This bill was also effective upon signature, and the governor signed the bill April 29th. Next is Senate Bill 4. This bill was drafted to provide some oversight to recovery residences, which are defined as residential dwellings that offer a peer-supported alcohol and drug-free environment. While recovery residences were the intended target, the bill extends these regulations to additional substance abuse providers, including drug abuse treatment and education programs and narcotic treatment programs. The law prohibits the offering or soliciting of any remuneration for the referral of a patient to a substance abuse provider. Section 2 of the bill defines fraudulent insurance acts to include excessive billing related to drug testing. Rule revisions will be required for the facility types licensed by DCH. Senate Bill 80 makes changes to requirements surrounding the use of prior authorizations. This bill applies to both pharmacy and medical reviews. Insurers will be required to post their PA requirements on their websites and share statistics on denial rates and the time it takes to issue a determination. Providers must be granted an opportunity to speak with the reviewing entity if medical necessity is in question, and adverse determinations must be reviewed by a clinical peer. Appeal reviews must be conducted by a provider actively practicing in the specialty under review. Providers must be notified of the need for a PA or of an adverse determination within 15 calendar days in 2022 and within 7 calendar days beginning January of 2023. If an insured obtains new coverage, their new insurer must honor a previously issued prior authorization for at least 30 days. This bill will go into effect January 1st of 2022. And then finally, I wanted to talk about Senate Bill 215. This bill authorizes certified medication aids to be employed in nursing homes. Currently, CMAs are not permitted in that setting. The bill also provides that any licensed facility in the state can conduct a certified nurse aid program if they meet the minimum federal standards for this program. These efforts are both intended to improve a workforce shortage throughout the industry. Rule revisions will be needed to implement this bill. The Office of Government Relations will continue to work with divisions throughout the agency to understand implementation requirements and ensure that timelines are met. Finally, I'd like to take a moment to express my gratitude to the subject matter experts throughout the agency. Despite the demands of their job responsibilities, the staff consistently and dependably provided feedback to the Office of Government Relations to ensure prompt responsiveness on legislative matters. I'd also like to thank Caitlin Ward, our legislative liaison, for her continued support at the Capitol and for ensuring that the department is aware of the status of any bill at any given time. If there are any questions, I'll be happy to answer them at this time.
Any questions, comments from the board for Brandy, please? Hearing none, thank you, Brandy, for that excellent update today, and thanks for all the hard work you did during the session and for the outcomes that we have. Thank you very much for that. And
thank you, Chairman.
And with that, concludes our agenda. Is there anyone who knows of any new business that needs to come before the board at this time? Hearing none, I thank the DCH staff for the background work that you did and all the documentation you provided to us so that we could review the items discussed today in advance. We thank you for that. And our next meeting is scheduled for June 10:30 a.m. And I personally look forward to being able to get together in person again in the very near future. Thanks so much, and have a good day. Goodbye.
Bye-bye.